We're going to the periphery for this particular conversation, where a lack of consistent definitions and nomenclature across clinical trials has made it rather difficult, shall we say, to assess some novel diagnostics, some devices, some drugs. And so in the March 10th issue of JACC, we have some common definitions from Peripheral Academic Research Consortium, or PARC, relating to the evaluation and the treatment of patients with lower extremity peripheral artery disease. And thank you very much for coming back. I'm with first author Manesh Patel, Duke Clinical Research Institute, and the director of the cardiac catheterization labs across the Duke Health Systems. This has been kind of a challenge.
Yeah, I want to acknowledge all the people that really had to come together to do this. As you know, peripheral arterial disease probably affects about 8 million Americans.
Yes.
And the patients who have peripheral arterial disease, of course, have increased risk of cardiovascular events, including MI and stroke. So a lot of therapies have been going on, both drug and devices and other things, to try to see, can we help these patients do better?
So what's PARC?
PARC is an extension of ARC, or the Academic Research Consortium, that originally came together to make consistent definitions for stent thrombosis, so that across trials we could understand how that worked. And PARC is an effort to do that for the periphery, if you will. So the group, which consisted of a fairly broad group, including academics, included clinical practitioners, members that are surgeons, radiologists, cardiologists. The FDA and the PMDA from Japan all came together. We had 2 face-to-face meetings, and we spent time on the phone. And eventually our goal was to generate consistent definitions, which we're happy to say we believe we've got sort of the data elements for a lot of consistent definitions in the lower extremity.
Take me behind the scenes. Were there any definitions that you particularly struggled with for whatever reason? They were just controversial, or?
You know, it'd be surprising, something as straightforward as, how are we going to say the stenosis in the lower extremity? Is it going to be 50, 75, 100? Is it going to be greater than 50, et cetera? So the definition of a significant stenosis, that's a great place for us to start. We also went on to talk about acute procedural success. So at the end of either an endovascular or surgical procedure, how would we deem in a trial that it was successful? And so what we were able to do in this is to at least put some barriers and sort of constraints around what we think are the keys, and so definitional elements that will hopefully help people understand.
What are the ones you're proudest of that you now think this is going to help?
Well, I believe in an extent the definitions around acute procedural success, defining the peripheral anatomy, and then having time points where you might measure with ultrasound or other surrogates and how you would measure. I think that table, and that'll probably be something we see in a lot of trials, hopefully.
What other particular definitions did you have problems with, or that you would like to talk about?
I'll just say the two other things that it's always thoughtful for, and I think the FDA and others are looking at this, is, you know, we spent a lot of time looking at the syndromes. So another way to think about peripheral artery disease patients, there's certainly asymptomatic patients and the patients with gangrene, but in between the two are patients that are symptomatic. And so we provide the data elements that are similar to the Rutherford classification or the Fontan classification, but we sort of provide some extra information there. And I think that was the first step. And then the other one is outcome measurements. So aside from success of the procedure, do they walk farther? We define walking distances and tests you might use. Amputation, what is a major amputation? We define that so that the trials will look at that. So in our perspective, we think this will help out in trials.
I mean, some of the broad categories included the clinical presentation, anatomic depiction, interventional outcomes, surrogate imaging, and physiological follow-up.
Yeah.
I mean, that covers the waterfront.
We believe so. That's why it took us a few years to do it, we think. But we believe that in the clinical trials for PAD, if you're using a device or a drug, this will be hopefully very informative. The other thing we were able to do is to standardize some of those definitions, hopefully into the national registries ongoing for peripheral vascular intervention with the ACC. And we're hoping that these data elements then also will populate the trial so that we can have a standard nomenclature.
This is the March 10th issue of JACC. Please check it out. It is a state-of-the-art review. And from ACC 15, for CardioSource World News, I'm Executive Editor Ray McGuire.